listening to Kingston Community Radio on WGHQ Kingston. On your radio at 920 AM and 92.5 FM, and also online at mykcr.org.
Central Hudson reminds you, when you're doing yard work, safety matters. If you use a ladder, be aware of overhead electric lines, including the service wire that runs to your house. Even wooden ladders can conduct electricity with dangerous results. And be very careful if there are electric lines above or near a swimming pool, and you're working with skimmers, brooms, or other long-handled tools. Central Hudson wishes you a safe summer.
Long ago, you wouldn't think of galloping on a horse while doing calligraphy, and you wouldn't have attempted to ride your bike while typing a letter. Yet you think you can safely operate a multi-ton vehicle while texting? Behind the wheel is no place to multitask. If you want to BRB, drive now and text later. Lives depend on it.
Visit StopTextStopWrecks.org, a message brought to you by the National Highway Traffic Safety Administration, Project Yellow Light, Noise, and the Ad Council.
Hi, my name is Jackie Levezzo. I'm from Lake Katrine, and I support Kingston Community Radio because it is an invaluable resource to the community and its residents.
This portion of Kingston Community Radio is brought to you by Ulster Savings Bank. Visit their newest branch, conveniently located at the Ulster Commons Plaza in Lake Katrine. Experience the difference that local community banking offers with the convenience of another great location, easy access, plenty of parking, and a 24-hour ATM. Ulster Savings Bank, invested in community, invested in you. Member FDIC.
All right, folks, we're here. This is Thunder Thursday. My voice is back. Can you tell?
It just woke me up. No, I've been awake for quite some time. Good morning.
Good morning, brother. How are you?
I'm doing
Judge
well
brother,
as I
Donald
possibly.
Williams.
That's Judge Brother.
Judge brother.
Rarely,
I'm not. It wasn't
rarely
Judge.
when I was on the bench.
Or Brother Judge.
One individual, one defendant did call me Father Williams.
He did?
And I said, bless you, son.
Yeah.
15 to life.
For you have sinned.
For you have sinned, and you will now suffer the
Oh, man. So this is Kingston Community Radio, Thunder Thursday. We're broadcasting from high atop Rockefeller Plaza at 16 Lucas Avenue.
You know, somebody, good morning, and you are?
Morning. Tony Marmo.
And I only say that because you remind me regularly to introduce myself.
I know.
And I am Donald Williams, and what a pleasure it is to be
It
here
is.
with my
It's
good
great.
friend Tony again.
Yeah. It's,
Rockefeller Plaza.
Yeah. The Rock.
Right now,
The
Lawrence is looking out the back window watching the people skating outside. And it really is a magnificent place here.
Yeah.
Lawrence and everybody and you.
First
have
class,
done a great job.
professional, Thank you to all the, supporters that made this happen, and certainly the Maxwell family for keeping the KCR on the air over these years. It's been a long time, but we keep trucking, man. We're keeping one foot after the other.
Thanks to the Maxwell family.
Yep, absolutely.
I can recall being on that show over on John Street when I was an assistant district attorney. That was quite an intimidating experience the first time, Tony.
Yeah, right.
Walter was quite an intimidating
Yeah,
fellow,
he's a
but
big
boy,
guy.
what a great man.
Yeah, absolutely. Well, look, it's one of the few places where folks can get their opinion out, get their voice heard, left on the radio, live, and that's, we have to watch ourselves. I've gotten a lot better. Lawrence, I don't think I've cursed in like 2 years. I mean, I
don't think it's been that long,
wait.
but
You
really?
You mean on radio?
I think you dropped the S word when we first moved over here, just to break the place in.
Really? Okay.
Dropped
It was
the
early in the morning. It was early in the morning.
That might have been
S word?
S-H.
Yeah, the S word. We don't have to repeat
the
it.
doo-doo word.
The doo-doo word, I think.
Yes.
Doo-doo, boo-boo.
That you can't say that on radio?
I guess
I
not.
don't-
Wait, have you
No,
listened?
I don't think you
Are
can.
you serious? Have you listened to these sports radios?
Yeah. Yeah.
Oh my God, I've heard
Yeah.
far worse. And Kelley, it's a little disturbing.
How about the guy that they mic'd, Liam Henderson, on the All-Star game? I didn't watch the game, but they had him mic'd. They had the other guy mic'd, Freddie Freeman for Atlanta, and he was funny. He was good.
He's a bright
But this guy, Liam Henderson, couldn't throw a strike, so he drops the F-bomb. And he's
Well, he
mic'd.
kept cursing, and then
he's mic'd.
He's mic'd up. Oh
Yeah.
my God! But I think there's a 10-second delay.
Yeah.
No. I know.
It went
that,
over.
That was live. Yeah, I think that one got out there.
You were just reading lips.
That's an
Yeah,
FCC fine right
Yeah,
there.
yeah, I think so. Yeah, so that was good. So
They shouldn't have 10-second delays on live radio. It's
They should
no
not.
longer live.
right, exactly.
I remember
It's
Bill
filtered.
O'Reilly
Marist graduate.
edited
right?
a comment by me. I
Really?
said, yeah. It's an interesting story. If we have a little time, I'll tell you. It's really funny.
We have time. Let's go.
It was when I was district attorney. I can't recall the year, but unfortunately, I was thrust into the scenario where the part-time mayor of New Paltz was
Jason West.
illegally solemnizing same-sex marriages.
Right.
And I said, I've got enough things to do.
Right. I remember that. Yeah.
Burglaries and robberies and murders. and rapes.
Putting bad folks away.
So,
right?
anyway, it comes to me by the New Paltz PD. I had to authorize an arrest because he was violating his oath of office. It had
Right.
nothing to do
Yeah.
with same-sex marriage.
Right.
And the media,
Jumped all over. it.
national media, city media, state media,
Right.
all jumped all over it, and I had a job to do.
Right.
So
Right.
I told my confidential secretary, Lori Steiger, who was just amazing,
Yeah.
and I miss her dearly, but I said, Lori, look, I have a job to do here. I will interview anyone, but before 9 a.m. or after 5.
Mhm.
That's it. And I'm
Rules.
here, I'm here
Right.
at 7:30 in the morning,
Right.
and I leave late,
Right.
No problem. And I said, and this is the pecking order. I'm a county DA.
Right.
County press comes first.
Right. Right.
State next, national later. So the people, especially from the Today Show and other people were calling, they weren't getting it. It became a cause célèbre.
Right.
But we adhered to that.
Mm-hmm.
Lori came in one day and said, Don, I understand,
Right.
and I agree.
Right. Set up.
She said, but there's
guidelines?
this one really, and she goes, I'm getting bombarded, and many of the people, especially out of New York City, are not pleasant. I said, I understand. She goes, this one very nice man called me, and I told him, and he said, what if I interview him during lunch? And I know you don't take lunch, Don. You
Right.
went through lunch. So is it okay? I said, yeah, Lori, don't worry about it.
Yeah.
So going through the day, got to be about, 12:30. She says, Bruce is on the line now. Bruce.
Bruce. Okay.
I said, all right,
Lenny
put him
Bruce.
through, Lori.
Lenny,
So,
yeah. Bruce Morrow.
no.
Cousin Bruce.
No. Bruce ended up being the producer
For.
for the radio show, which parenthetically, I began to talk to this man on the radio, not Bruce.
Yeah.
And I'm going, damn, his voice
Sounds familiar.
And I'm also singing, I've done this now for
Yeah.
many years. I said, I'm getting a feeling this is a live interview.
Mhm,
It's not
mhm.
being taped.
They didn't
he-
identify who the interviewer was, or she did not. They just said, New York City.
Lori said
yeah.
Bruce is on the. Bruce
Bruce.
called up,
Yeah.
hooked it in,
Right,
and then
got
this
it.
other gentleman comes on. But I didn't know. I still thought it was Bruce. So the interviewer asked a very significant question. And again, as I was trying to put out, this is not whether same-sex couples should be able to marry under the
Right,
law.
right.
That's not up to the district attorney
Right.
of Ulster County to
The mayor of-
determine. It's most certainly not up to the mayor of New Paltz, who is a part-time puppeteer.
Right,
I
right.
said, this
You
goes-
use that word?
Yes, I did.
Wow, nice.
Well, not all the time, only when he started to get
Right.
into my Sicilian.
Right.
So he asks a question. I begin it by prefacing. I said, something's up here. I said, I
Yeah.
better turn on
Right.
the prosecutor trial lawyer
Right.
charm and be very
Right.
professional, stop the informal stuff. So I said, that is an excellent question, Bruce, and finally I will have an opportunity to answer this. And he goes, Mr. Williams, my name is not Bruce. This is Bill O'Reilly. And then, of course, he had to get a little shot in because he was embarrassed. He
Right.
goes, but perhaps you don't get my show up in your neck of the woods.
Of the woods.
I'm not going to tolerate
Yeah,
that.
yeah, yeah.
So I said, no. I was very proud of
Yeah.
this quick. I said, "No, Mr. Riley, indeed I do. I just choose not to listen to it."
Oh, great.
I tell that story
That's a
about
great-
the 10-second delay. What
Yeah.
do you think the chances are that that response ended up or was edited
0
out?
to 1%.
Yeah, that's what I think.
Yeah.
But that was
Yeah.
that was one of my.
Yeah. Well, interestingly, and I think Walter Maxwell mentioned that he was a graduate, Walter was a graduate of Marist, as was Bill O'Reilly. Maybe the same year.
Walt and Frank Guido actually graduated the same class.
Butchie?
kidding.
Butchie Guido. My dad went to
Okay.
the Air Force right out of high school.
Right.
He graduated Ellenville, went to 4 years in the Air Force, and then went to Marist.
Interesting.
A lot of people did that back then.
Yeah,
Pam's
yeah, yeah.
dad
On
did
the
same
GI
thing.
Bill, maybe. GI Bill, maybe? I mean, GI Bill paid? I think
don't
so.
know.
I hope
Maybe.
might have.
someone
But I know
paid.
he
Have
went
you
to the
seen-
service first. He didn't know if he wanted. I don't know. I'll have to ask my mother. I don't know if maybe he wasn't interested in school. Maybe he just.
Right.
Who knows?
Yeah, 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 yeah.
Well, I hope someone
But
paid.
then he
Have you
ended up
seen
going
the
to Marist.
tuition
He
at
liked
Marist?
I'm going to guess it's 75 grand now. I have no idea.
Oh, last time.
To go to
last
Marist?
time I heard-
65? How much?
It's a
To go to
tuition.
Rutgers, 2 semesters at Rutgers, 1 year at Rutgers is
board?
85,000.
85.
Yeah. So
A
That
year-
includes room and board.
that's everything. Kid
A year-
I mean, it's going to
A
be.
year for me at Seton Hall University undergrad was $3,500.
Yeah.
However, it did take me 15 years to pay off my 10-year student
Yeah,
loan because the
geez.
salaries were $15,000 for an
Wait,
assistant
when Clinton
TA.
was elected, he didn't wipe that out for you?
No, he wiped his memory out.
Selective
But,
memory at that.
but he did remember he did not inhale.
Yeah, that's correct.
That's right. That's
Correct.
And he never had
Yeah,
Sex
sex
with
with
that.
that woman.
with that woman who,
Yeah.
what was she, 19 at the time?
Something like that, yeah, yeah.
So politicians, what was that? What was the politician, the app, the little blurb you just showed me about politicians or leaders?
Oh, yeah, leaders.
I loved it. It was great. What did
Yeah.
it say? I think you can say that on
I
radio.
can probably say it, I can't remember it, but my mind is like a sieve at times. Hold on, we'll see if we can call it back
I
up.
can recall it, but
You
I
can?
will probably misquote it. so.
Yeah. Yeah, I'm not quite sure. So I want to give a shout out to Leanne Marmo, who started a new job. Started a new job. Yep, she's working at now. She's working at Caramount. She's going to work in the Lake Katrine office and the pediatrician's office.
That's fantastic.
So that's where she spent many.
And how did she
years.
locate this job, Tony?
Not
She
through
had
me.
this-
No, not through
She
Norman
didn't go through
Staffing.
your-
No, not through Norman Staffing.
That more credos to
Yeah,
Leanne.
no,
She
she-
did not use her husband's
She didn't. Yeah, no.
employment
she,
agency.
No, she did not. She, a friend of hers had mentioned that there was an opening and someone had just resigned. It's not even basically posted yet, and she applied. And she's got I don't know how many years experience in. Oh, she's been a nurse for a long time, but she worked in a pediatric office across the river for 10 or 12 years, and then worked at Kingston Hospital for a similar number. So so she's training right now, going through an orientation. But so
What is the position itself?
it's like a
She's a
triage,
pretty lady.
triage nurse.
But for
a nurse.
that one error in her.
Yeah, I know. Judgment. It was the judgment day, so to speak. Yeah, I know.
I'm not talking about you, Tony. Why are you being so defensive?
Yeah.
That's amazing.
What was the error then? Let me try to clarify.
Well, I don't want it. It's a
You don't-
personal thing. I don't want to embarrass you or Leanne, but I most certainly was not directing.
No,
Why would you think in a second that this individual that was a leader of this community
Right.
would take this
Right.
opportunity
Well-
to publicly embarrass you or to put you on the defensive?
That's okay. I'm of the philosophy that if you dish it, you got to take it. That's how it goes.
You've always
got-
been very kind to me.
Oh,
you
well,
always show great respect.
I do.
We laugh at each other
We
and
do.
joke.
We
It's all
do.
in-
We do.
In fact, but for the fact I have to get up at 3:30 to get ready for this show.
Yeah. Are you studying? Is that what? I know you do a lot of
Well, I
work
do-
previous to
To begin
any,
with,
any,
yeah,
any
I
assignment.
haven't-
Any
No, I normally do get up about 5 to get ready because
Right.
I want, I have senior moments. If I
Right, you wanna
researched it the day before, I may forget it today.
Right.
Just ask President Biden.
Yeah. He does forget stuff.
However, I have it down to a routine. I go online for the Freeman. It takes me 3 minutes to read it cover to cover, which
Right.
I can
How
recall.
long?
3.
3 minutes.
3 minutes.
3 minutes.
Yeah. I'll go slower.
Wow.
I'll go slower.
Yeah, no, 3 minutes. No, I was trying to segue into a little serious topic. I was thinking how to phrase it.
Go ahead, just ask.
Because we were talking off the air a little bit about the gun violence that happened over the 4th of July weekend in not necessarily Kingston, obviously, but just throughout the nation. And I think we were talking about Chicago, where significant gun violence.
I read, and it was about a week ago
Yeah.
I read this, but I read that over the July 4th weekend, and when I say weekend, I just mean Saturday and Sunday.
Right, not the
not
holiday.
including Monday.
Right.
In Chicago, on one weekend, there were over 100 shootings, 18 deaths. Now, Chicago and the state of Illinois have some of the strictest gun possession laws out of the nation. New York City, New York State have some of the strictest. And I agree that there have to be strict limitations and restrictions. Remember, as county judge for 10 years, one of my responsibilities was presiding over pistol permit applications. But the most, and I'm tired of saying progressive.
Right.
Of late, I'm not sure how progressive it is. And look, I'm not a conservative, I'm not a liberal. I believe I'm a right-of-center moderate when it comes to criminal justice, tougher. But the reason is not one thing for gun violence, and it is most certainly not people that legally possess handguns.
Right.
It is not. I brought on those statistics a month
Right.
ago when we were here, and for example, out of more than 100 people interviewed in Chicago, individuals who had committed crimes connected to gun violence, it was 8% had obtained the weapons illegally. We have to stop blaming
Right.
the law and the handguns legally possessed,
Right.
and instead start holding the people accountable, as I did when I was judge. And this
Right.
is not about me, I'm out of the
Right.
system.
Right.
Hold those people accountable. It is the individual behind the gun, not per se the gun. Now, there is a proliferation of weapons in this country that does not exist in other countries, and I do strongly believe in restrictions on the possession of handguns.
And the
There's
qualifications and
qualifications,
Yeah,
and
you-
there are strict limitations
Right.
here. And
But,
I
but if
actually did
people
those
can get
things.
those illegally through whatever means they get them illegally, how do you stop that pipeline? I mean,
That's a much more complicated
Yeah.
situation. Number one, it's not number one. It may be 1A, 1B, but you have to put the fear into those individuals that will obtain these weapons illegally and use them to commit crimes of violence against others, that there will be significant consequences. And Tony, sometime bring on some of the Kingston Police Department
Yeah, sure.
officers. We should do that when I'm
Yeah,
not
yeah,
here.
yeah.
And ask them during that 10-year period of the message that was being sent out
Yeah.
from me on the bench of what happens.
Right.
One of the first cases I had was a young man that had been through the family court system, and everything had been done possibly to get this young man on the right path repeatedly. When he came before me, he actually had in his apartment surveillance cameras to see
Jeez.
if the police were coming up, automatic weapons,
Wow.
all kinds
Right.
of dangerous weapons. And because at the time he was 16 years old, by the time he got in front of me, I think he was 17 or 18, because of that, he never was held really accountable
Right.
for anything.
Yeah.
And when he got a very fair hearing, but he got a very extensive sentence, not just because he was dangerous and everything had been done to try to get him on the right
Rehabilitate him,
path, and
yeah.
it failed, and he was placing many other individuals, including police officers' lives in danger. So a message was sent. And after about a year to a year and a half, that message was not only being communicated from, also he was a gang member of blood, but not all, it was being communicated to everybody. Did it stop crime? No, but if you ask those officers, it had a significant factor.
Right.
And that's a part of it. The other part is also, and I hate this term, root causes, because when the vice president talks about the root causes of illegal immigration, I'm sorry, it is illegal immigration.
Yeah, illegal, right. The operative is illegal.
Illegal.
Yeah.
But as root causes, yes, you do have to understand. There's never a simple answer for these complex areas, criminal justice.
No, absolutely not.
And most certainly poverty.
Yeah.
Most certainly individuals in a particular part of the community that don't have the opportunities that you and I and others do, most certainly. And there have to be I hate social justice. I hate the term. I love social justice. I hate the term. There has to be education.
Yes.
We've got to get the family unit back together again. I sound like Vice President Dan Quayle.
Dan
But
Quayle.
the family unit does not exist in so many of these lower income families. And those kids don't have a chance.
Yeah.
We've got to give them a chance. But we also, like with children, you have to set parameters. And if they continue to go beyond those parameters, there must be consequences for them.
Right.
And a message of deterrence has to be sent. Today, in this county too, Tony, and I will not go through details and name names, there is a fear and or a philosophical reluctance to hold a people accountable. This system at the felony level cannot be run on a popularity contest.
Right.
You've got to be able to suffer the consequences yourself.
Right.
And that's missing. So from somebody from criminal justice, that is the first thing that we must look at, sending a message of deterrent, while at the same time trying to put so many initiatives and programs together that will also attempt to address the societal issues.
Well, I mean, I think...
Not just blame.
I get it, and I think...
Constitutionally possessed handguns.
Yeah,
Don't blame
I get it. One of the solutions, I think, is people have to get out and vote for either for or against, people that are in office that they don't believe is in the best interest, their programs, practices, philosophies are in the best interest of their community, their county, their state, and if people don't get out and vote and change the folks that are in the office, then we get what we get. I mean, they enact laws.
We get what I hate to say this, what we deserve.
Well, right, exactly.
And we are suffering that.
Yeah, I get, I absolutely get that. It's, it's been, the pendulum swings, right, in certain ways for certain, and at this point it seems like, bail reform just chips away at the structure, that's put in place.
We were talking previously, and I happen to like Dave Clegg.
Right.
And I happen to know Dave Clegg since when I was a chief assistant or DA. I tried a major arson of Sanborn Cleaners that was by the old IBM after IBM left. And Dave came into court and represented the Sanborn man that was convicted of it. And he did a great job. He's a fine lawyer. Philosophically, about criminal justice, Dave and I disagree. But Dave is the one that's being dragged through the mud here.
Right.
This is not just about Dave.
Right.
I mean, 11 assistant DAs left. Some left because of their intense loyalty to the prior administration of Holly Carnwright and young Mike Cowell.
And that happens. And
some left because they disagree
with leadership
his
changes,
philosophies. Many left, honestly, because of the discovery law, the bail reform and discovery law. The work that an assistant DA has, if they do it right, is intense and grueling. But when they had, under these new discovery laws, which basically for people that don't know, when a case occurs, a felony especially, the prosecutor is obligated to give the bulk of their file
over. But
they typically don't have to give the volume of it, the transcripts, until before trial, which could be 6 months after the incident or later. So now they're being required to give it immediately, and it is an overwhelming burden, additional workload on these assistant DAs. A lot of them said, we just can't do this anymore. Right. It's too much work. Many of them went to the public defender's office. These are criminal prosecutors.
Yeah,
they don't have the same burden.
Yeah.
I mean, the public defender has a very difficult position,
right,
and it's a difficult job, but they do not have the paperwork that's involved for what the ADAs have.
Burden of proof.
That didn't exist when I was on the bench or when I was DA. The discovery laws have gotten crazy liberal politicians, because this is not progressive.
But
crazy liberal politicians with bail reform that went way too far, and also the discovery proceedings that went way too far. If those discovery proceedings existed when I was on the bench, Tony, I mean, I prided myself on getting rid of a backload of cases I inherited, which was substantial, and moving cases quickly to disposition. And because of the victims waiting, the defendants waiting, everybody waits. And I moved things quickly. But if these discovery laws existed then, I would have been hard-pressed to get these cases resolved as quickly as I did before. So it's a disaster.
Yeah, it is. We were talking about earlier, the changes, granted, this is now some time going back. I mean, if you go back, whatever, into the 90s, and, the demographic, the political representation in the county has changed.
You could say demographics. The demographics have changed. The city of Kingston is now Brooklyn North, which has so many good things about it. You can see our uptown community is thriving. Money is pouring in. But as money pours in, rentals go up. Property prices go up, and people that have lived there their whole lives are being forced out, along with the fact
Or bought out, right?
Or bought out.
Here's a number.
I mean, honestly, I'm hearing numbers at my place.
Yeah, staggering.
I couldn't afford the price I paid 30 years ago for this house.
Yeah, I'd love to see the statistics on exodus from New York State. I'm sure they're out there, but I think they're growing because of this phenomenon of the pricing. So people are saying, okay, well, what, like Scott Harrington, he's resides in St. Augustine,
close
Florida
friend of
now.
mine, Alan Masters, went to Pennsylvania.
That's not unusual.
His taxes went from $14,000 to a comparable house to $4,000. He's saving $10,000. That's when you pay school and property taxes.
Right.
That $10,000 is after tax. So you're already getting tax for income.
So people wind up voting with their feet and saying, you know what, I'm done with what's going on in New York State, and I'm leaving, and I'm going down to the Carolinas, Georgia, now Florida, wherever, Tennessee. And now the interesting part, I'm sure down there they're saying this influx of New York State people, which is happening, is changing their
southern communities, the
ecosystem there.
New York State people and people that are crossing the border illegally. I mean, I can't imagine what it's like to be in Texas. Or
Leanne's aunt lives
Florida,
there.
Arizona.
Yeah. So it's a crazy world. I mean, I guess. But it was probably crazy, and we talked about this before, if you go back decades, the 60s were turbulent over the 50s, which were kind of sedate, not overly sedate, and then the 70s and 80s, and, it just keeps changing.
It's a pendulum.
It really is.
Unfortunately.
Right.
And when we look at our politicians, the ones that seem to get elected the most are the individuals that seize upon the political wave that comes in. So we rarely get moderates. Give me somebody left of center, right of center, but let's get to the center. However, what I heard, what is the media? I heard a term for it last night. I can't recall. These senior moments where I short-term memory.
So we have a couple of great guests coming up after 7:30. We come back from break. We have Steve Kelley, CEO of Kingston Hospital, He's a great guy. He's done a great job down in the Ellenville community area and for Ulster County. He's going to be calling in, and then at 8 o'clock we have Sue Marcy, who's, I want to say, Vice President of the Ulster United Way, and she's going to be in the studio with us. And then at 8:30, it's you and me, Julio, down by the schoolyard.
Oh, geez. Garfunkel and Simon.
Right. That's us.
I used to sing that song in the shower frequently.
Yeah.
My wife,
No, dude, I don't need an image of that, bro. I mean, come on.
I understand
The
that
show's been going so great.
Judge, bro.
Tony was telling me that you've told him when I'm not here, that's an image that comes to your mind on a regular basis.
All right, let's go to break, Lawrence. Let's go to break.
Listening to Kingston Community Radio on WGHQ Kingston. On your radio at 920 AM and 92.5 FM, and also online at mykcr.org.
Swimming pools are great for family fun, and Central Hudson wants you to play it safe. Never operate an electric appliance next to or in the pool. Be sure pool motors and filters are grounded. Have them installed by a professional and serviced by a licensed professional electrician. Be very careful if there are electric lines above or near a pool, especially if using long-handled cleaning tools. And if a storm is nearby, get out of the water. Your safety matters.
Hi, I'm Steve Thomas for Habitat for Humanity Restore. Habitat Restores are nonprofit home improvement stores and donation centers that sell new and gently used furniture, building materials, and appliances to the public at a fraction of the retail cost. The Ulster County Restore at 406 Route 28 in Kingston needs your donations. Call our hotline at 845-853-7499 to schedule your free pickup. And thanks.
Everyone is talking about healthcare these days. America spends twice that of other developed countries on our healthcare system, yet our health ranks near the bottom. How can we stop spending so much and getting so little? By shifting to a system that gives more patients access to strong primary care. Primary care can help make America healthy again. To learn more about the benefits of primary care, visit www.healthisprimary.org. This message is brought to you by America's Family Physicians.
Screening exams for breast, lung, or colorectal cancers are necessary to detect and treat disease at its earliest, most curable stage. But you may have some concerns and questions. Answer your questions and ease your fears by visiting radiologyinfo.org. In addition to information on screening and wellness, you'll find more than 200 descriptions of radiologic exams, procedures, and treatments to help you prepare. Get informed and be prepared. Visit radiologyinfo.org. Produced by the Radiological Society of North America and the American College of Radiology.
Hi, this is Jared Mans from the Spring Lake Fire Department, and I support Kingston Community Radio, and so should you.
This portion of Kingston Community Radio has been brought to you by the First Savings Bank in Ulster County that still remains local to this day. Ulster Savings Bank, a community bank that's invested in local business, invested in community, invested in you. Ulster Savings Bank, your one-stop resource for everything local. Locations throughout the Hudson Valley and online at ulstersavings.com. Member FDIC.
Steve on. All right, folks, we're back. This is Thunder Thursday. That was that wasn't really a good one. This is Thunder Thursday.
You know something?
What?
There are so many things you do that make me laugh. Like those reading glasses today.
Yeah.
Would you just look at the item? Where is the camera?
They're clear.
I think we ought to have a call-in show with people that are seeing this to say, what did they really think of those glasses?
Yeah, they're clear lens.
And you're a handsome guy. Don't take that the wrong way.
Yeah, no, I get it. I have my little bulldog shirt on too today.
What's that got to do with it?
Well, I don't know. I figured you inspired me.
I normally wear pink.
Right.
Show the softer side of the former district attorney and county judge. Today, linen, white.
Yeah, you look good. Like the horse.
I'm losing weight.
Yeah, fantastic.
It's long overdue.
So this is Tony Marmo.
And Donald Williams.
Right. And so do we have Steve Kelley on the line?
No.
Not yet. Okay.
We don't.
Oh, we get to
But
talk
the lines
more.
are wide open, ready for Steve to call.
You know something?
Hey.
I wish people, I know it's early, I wish people would seize the chance to call in, because at this point, they can consider it open season on former county judge
There
and
you
district
go.
attorney.
There you go.
There are no ethical restrictions that exist for me anymore, that I can answer questions directly and honestly.
Yeah.
So call in, folks.
Maybe he's in the lobby, Tony.
What is that number?
331-9255.
331-9255. Call in, folks. You can ask anything you'd like. I have thick skin,
Yeah.
and you may ask anything, and you can make comments. You don't have to agree or disagree. Just don't be afraid to call.
I still screen the calls anyway. That's just,
It
for the
doesn't
host's
bother.
benefit.
Well, yeah, that's okay.
You know,
And
Lawrence,
if you
I don't know
tell
if
me
you,
what you're calling about,
Well, I want to talk to the judge. Want to talk
I
to
have
the
no-
got a question for
Oh,
the
wait, I
honestly
think this
have
is
no
Steve right
problem.
here.
Look,
Hang on.
Yep. Yeah, I think you could handle it. I mean, you handle Bill O'Reilly. I mean,
you mean Bruce?
Yeah, Bruce O'Reilly. All right, good morning, Steve Kelley. How are you?
Hey, I'm good. How are we doing?
Good morning, Steve.
You're on with former judge and Ulster County DA Don Williams. And you guys probably know each other along the way
I'm
somewhere.
sure we've met many times, Steve. It's just
yeah.
I'm having
Yeah,
senior
many
moments
different
of late, so.
Never at the bench, I'm sure, Steve.
You know, I do say that,
Never been in
Steve.
front of you, thank God.
Yeah, I do.
Seen what you could do.
It's not that bad of an experience for guys.
You need a little bit
Although,
more of that these
I
days.
do get that response. It's normally that people put up the sign of a cross and say, back.
Yeah.
But it's good to talk to you today.
So Steve, you have a difficult job these days of sorts, I guess. You do it masterfully where you are, but you're in the healthcare arena, and the whole world is changing. With Don Williams and I were just talking about that, how the world is pendulum swing and things have happened. Give us just an overview, kind of where you see healthcare. I know this is kind of right out of the box. I'm sorry to hit you with this one, but the macro look, and then we'll drill down to to Ellenville, Ulster County, Ellenville, New York State. So I mean, just start with what you're seeing, and your folks know that you're the chief executive officer, president chief executive officer at Ellenville Community Hospital, which is a rural hospital, correct?
Yes.
Yeah.
Rural hospital.
Yeah, we're not
New York.
talking about medical centers.
Not that far away.
Right, not that far away, hop, skip, jump. But give your thoughts about what you're seeing on the healthcare scene nationally, because I know you've been speaking nationally as well. So tell us what you're seeing, at the national level.
We're seeing a lot of consolidation where a lot of big systems have been formed. I think they were formed supposedly so that there would be more efficiency in the system and it would save a lot of money. That's what they always said.
Mm-hmm.
I don't know that they really do, because I think they eliminate competition and they make it, it gives them, I think it's really more in response to the large consolidation on the payer side. So there's fewer and fewer payers, that's our insurance companies.
Right.
And so they have greater and greater power as they have larger and larger, patient base that they're insuring.
Mm-hmm.
And so you have those two things coming together, squaring off against each other.
Right.
And but that doesn't always have to be that way. We have a lot of hospitals that have gotten into trouble. They have felt that the only way out was to be taken over by somebody big,
Mm-hmm.
and it doesn't always work out that well for the community, because the parent, the bigger one, the owner, is really in business to do what's best for them.
Right.
And so they do the best that they can, I guess, but they aren't going to forget about the flagship, which is their
right.
That's their main responsibility. And so when they take over a small community hospital or a smaller community hospital, they rationalize the healthcare services to what they believe is efficient and works best. And they can, we've seen that here in Ulster County, where
Yeah.
Certain beds have been moved around because they want to consolidate services for a region.
Yeah, you're
rather
talking
than,
the mental health beds is what you're talking about, right? How they moved out. Yeah.
I mean, I think they probably had very good rationale for doing that. These are solid business people who know what they're doing, and they're looking at it on a regionalized basis.
Right.
Instead of the specific concerns of a smaller locality.
Right. Which, I mean, that's a great story. I'm just curious though about what you're seeing out of a lot of things have changed in Washington certainly, and I'm not talking politics here. I'm talking about the Medicare and Medicaid policies, and are you seeing any changes there, either good or bad, in terms of what the government sees? I mean, we're only spending like $4 trillion or so on healthcare in this country.
That's not part of the infrastructure.
The largest business in the country.
Yeah, right. It is pretty much the largest
industry.
Yeah,
it is.
Yeah,
and rightfully so, Steve, that it's such a large industry. But anyway.
Yeah. So any thoughts about do you see any cutbacks in Medicare coming, and how Medicaid is treated as well? I know that has the states involved in it, but without being too esoteric about this, I mean, what are you sensing or seeing from the electeds about Medicare?
Well, I think that they coming off of, or still in really, a pandemic. We're sort of between waves at the moment. I think we'll see another one this winter or this fall. I think that they don't want to speak very loudly about cutting Medicare or Medicaid for that matter, because these are the safety nets, and they're absolutely needed. They're just, I don't know. I mean, what would people do if they didn't have that? It would be disastrous. So at a time when healthcare is at the top of people's minds because 500,000 Americans died in the last year from COVID.
Yeah.
We also had almost 100,000 die from the opiate overdoses. So we're not at a time when it would not be a politically great time to be talking about, well, we need to cut healthcare. So I think that will be done in much more subtle ways, in regulations and things like that, that I just can't see elected officials taking that kind of risk. I think that it would be extraordinarily unpopular in this environment.
Yeah.
So I don't think they're going to do too much. I just don't think they're going to do that much right now. I mean, they may be planning to, but I just can't see it because we're just so tenuous. And the healthcare system, certainly here in New York, in the metro area especially, but here in the Hudson Valley, was almost overwhelmed. The city got absolutely blasted in the first wave, and we got crushed in the second wave.
Right.
So, I mean, we were right at capacity in our system. So, it's been a harrowing year for us. And I can only say how proud I am of the brave staff that work in my hospital that face this unseen enemy every day, wondering if they were going to get sick and bring this home to their families. I mean, it's just...
Steve, just out of curiosity, and I don't mean to put you on the spot like this, what is the percentage of employees at your hospital that became afflicted with the COVID as a result of their exposure? Do you have any idea what the numbers would be?
Well, that's a difficult question to answer. We did have a number of our staff who did get COVID. Fortunately, no one had a fatal case of it, as other hospitals have experienced.
Oh, gosh.
But it's hard to say whether they necessarily got it in the hospital or if it was brought home to them by family members who worked in dangerous places like prisons in our area. That's the biggest industry.
Yeah, you just hit on this particular question. You hit on one of the real difficulties of using any statistics to try to determine a result or consequence.
But tracing of that was impossible.
Tracing that is virtually impossible. So, well, it's good to know.
It is difficult, and so I would say that we've had employees who did get it. Fortunately, they all recovered.
That's great.
I couldn't say for sure that they got it with us, but they could have. That's the fact of the matter. We had a lot of COVID patients, and they certainly could have.
Absolutely.
Steve, talk about the plight of rural hospitals. I know you sometimes stand in the land of giants with all these major medical centers, and you're roughly a 25-bed certified hospital that has an extensive outpatient network and an ER that serves a community certainly larger than Ellenville. But talk about the plight of the rural hospitals, certainly around here, but certainly nationally too.
So what's happened is that when hospitals were built, including Ellenville, and actually most hospitals, they were built in the 60s, 70s, and it was very much a inpatient-centric business at that time. And that's the way people were treated, and that was the mission of hospitals. And they were probably 90% inpatient and maybe 10% outpatient.
And by the way, was that thank you to Joe Resnick?
It was probably 75% inpatient and 25% outpatient. And so in my tenure there, that has flipped upside down, and we're 75% outpatient and 25% inpatient in revenue. So that is really a very big change in the way that we view hospitals and in the way that hospitals deliver care and the role of a hospital. So that's quite a big pivot, and a lot of hospitals have really struggled to make that pivot because a lot of the leadership has grown up in the hospital sector. This is how we do it. This is the best way to do it. If there was a better way to do it, we'd already be doing it that way. It's wrong for us to grow our outpatient business and not focus on our inpatient business, that kind of thing. And the outcome of that is is going into financial distress, as Ellenville was, and having to be taken over by a larger entity or bailed out in some way. And our hospital has experienced twice being in financial distress. And the first time we opted for being taken over by a larger entity, and in the second financial distress, our plan of reorganization was to become independent, just the opposite. And that actually worked well for us. There's no safety net, but there's nobody holding us back, and we were able to really move quickly to reorganize into a sustainable model. And today we're doing very well.
It's to your credit and your staff's credit and your board's credit. So congratulations. How long have you been there at the CEO?
Almost 18 years.
Wow. Amazing. Yeah, the average life of a CEO is about that of a fly. I think of 30. I mean, 30 seconds.
What does that speak well of what you've done there? My God.
Yeah, it's incredible. It's an incredible track record.
Yeah.
Just quickly,
We're doing amazing stuff, and we do get to speak. Before COVID, we presented at 19 conferences around the country on our work on multiple different things around our work fighting the opioid epidemic, our prowess at developing IT systems, and change leadership. We've done a lot in that area. We have really done a lot on efficiency and effectiveness. So, for example, our emergency department door-to-door time is just about 100 minutes, and that is not like a best day or a best week or a best month. That's 13 consecutive years. That is sustained performance at a level that is not to be achievable by most of my counterparts.
Shy of 2 hours. That's kind of staggering. Usually it's 2 days, and a lot of ERs bring a book and be prepared to stay.
40 minutes. An hour and 40 minutes. Healthcare on demand, 365, 24 hours a day.
Yeah.
That is. I'm very proud of that. I think.
Kudos to your staff, the folks that are on the front lines. Yeah, absolutely. I had mentioned earlier, Ellenville was founded or created back in the mid-'60s. Is that what you said during Congressman Resnick and perhaps LBJ's tenure? Is that correct?
Yes. LBJ actually came and visited for the grand opening.
Yeah.
And he was there for 2 days, not just flying in and flying out. So Ellenville had a lot of juice at that time. We had the Channel Master factory, and we're very, very successful. Hotels with the whole Borscht Belt. We anchored the eastern side of it with the Nevele. So it was it was really a go-go time in that part of Ulster County.
Yeah, and we talk about pendulums today. Seems to be the theme of the show in terms of how, decade to decade things change, and I feel down in that area of the county things are, swinging back or starting to swing back in terms of positive. Certainly healthcare and education are two key factors. And
certainly is. Things are definitely getting better. Definitely, we're seeing a lot of businesses moving in. We're seeing a lot of interest in the area. A lot of people buying up second homes or even primary homes, moving out of the city. So there's been a real silver lining of the COVID, the COVID waves in New York City, in the metro area, where people wanting to get out of there, people being able to work from home. It's very affordable to live in the southern part of Ulster County, which I understand is not so affordable in the north and along the river. So I think we're being discovered now. People are just buying up the real estate, founding businesses all over. It really is an exciting time to be working.
It is, and at
we are. I mean, we've been busy too. We're building too.
Unfortunately, and I agree with you 100%, Steve. But unfortunately, we also have the problem is as the costs of living, apartments and homes go up as a result of this influx, there are so many other people that simply working people that can't afford to live here anymore. Mm-hmm. That's the downside. And I know that doesn't fall under your area, but is anything happening in the southern part of the county, in Ellenville or surrounding areas, that they are addressing those issues, affordable housing? And I'm not just talking about the affordable housing that we typically identify with people that are unemployed, but people that have jobs but simply can't afford to live here. Is something done that you're aware of in your area of this county that's addressing that issue?
Don, you just keep tossing me softballs.
That's unusual for him.
Not-for-profit joint venture to build affordable housing in New York State. We have it right on our campus.
That's fantastic. Yeah. And I'm embarrassed that I'm not aware of that, but I do not stay in tune with things as much as I used to. But that is absolutely fantastic.
You and I may have to take
built 144 units of affordable senior housing on our campus. And
that's tremendous.
Looking for more land because there's such a need for affordable housing.
And just looking at the school and property taxes and how they've been impacted in this community, the Kingston Consolidated School District area, it's pretty tough. Mm-hmm. A friend of mine moved out of New York State because that retired teacher, who is married to a retired teacher, went to Pennsylvania, and their taxes went from approximately $12,000 or $13,000 a year, school and property, down to $4,000 to live in a comparable house in Pennsylvania. And it's difficult, especially for people that are in the area of Medicare. So that's really... Let me see if I can figure out some more softballs to give you. That's not my reputation.
Yeah, right. It's just
right. I can see sometimes when I have politicians that we're interviewing here that Tony begins to
cringe a little bit.
Cringe a little bit.
Steve, talk about, you mentioned the opioid crisis, and I think perhaps it was bad before. Did the pandemic, in your opinion, make it worse in any way, shape, or form? Or talk about that a little bit.
Okay, so in 2018, we had, I believe, 56 deaths in Ulster County, making us the second highest death rate per 100,000 in New York State. Wow. So we want to talk about that problem. Us and Sullivan County are the two highest, worst eye of the storm. We are it. And we put a lot of effort into, along with many others, our partners, including the sheriff, Ulster County, Step One, the Institute for Family Health, a whole lot of partners. We worked together, and we were able to drive down that death rate substantially in 2019. We had, I think, 31 deaths, so about drove it down 41%. That is just
Wow.
a tremendous.
41%. That's fantastic. Now, Steve, it's driving down the death rate.
And then we gave it all back last year.
Because of COVID. Yeah. Is the death rate directly correlated to the number of individuals that are becoming addicted to opioids, or was it something in the care early identification that, in your opinion, was successful in that? Obviously, COVID takes it all out of the equation. There's no way of truly understanding. But what I'm trying to ask is, what is, in your opinion, the best way, the most direct way to address opioid addiction? Not so much the death, but the addiction.
Well, we spend an awful lot of time and energy and money on trying to help people to cope with their addictions, and then to eventually go on to Suboxone or other types of medications, or go cold turkey, which is not really so practical, as we've discovered.
It is not practical, Steve? Is that what you said?
No, it's not practical. It doesn't, just very rarely, well, I didn't say rarely, but not as successful as putting someone on Suboxone, which replaces the withdrawal, so they don't get withdrawal, and it doesn't make them high. So,
Steve, is that kind of like methadone? Methadone was?
Suboxone.
Yeah.
Is that just, Suboxone does not create a high, Steve?
Very minimal. People are able to function. They're able to go back to work. They're able to repair their relationships that they've burned so many people with their cravings and addictions, and their stealing, and their lying, and their all the bad things that come with addiction that are really difficult.
That's great news,
Judge. I would say it gets back to the issue of how do folks get guns, and it's the cheap drugs that are out on the street, the whatever gang related, or the supply is out there. These are difficult times, and the bad folks are just flooding the markets with inexpensive. Maybe it gets a little experiment, a little social. Hey Tony, why don't you try this? Blah blah blah. One thing leads to another. We've had several people. Val Dwyer is very involved in this whole area. And it's societal. I mean, it's kind of like the other breakdown issues that we were talking about, family unit, and there's multiple causes and reasons. And thankfully, folks like Steve Kelley, Ellenville Community Hospital, and others are banding together to try to build up a wall, and say, hey, not in our community, it's not happening, and fighting hard to do that. So, Steve, thank you for doing that and being a voice of we can beat this if we can get ahead of it.
In the long run, we have to stop the flow of fentanyl. We have to stop it, and this is something you can argue about how to do it, but law enforcement, which is very effective at many things, has not been able to intercept this flood of
suppliers,
fentanyl, which is
the supply chain, right?
Well, we have to eliminate or reduce the demand.
And we have to figure out how to stop people from starting.
Right, exactly. You can't, in all the years in law enforcement, Steve, and I prided myself in attempting many different, being tough on drug dealers, not drug users, drug dealers, but at the same time we created drug court. We created the community corrections program in a community that was perceived as being extremely conservative. We were ahead of the curve outside of perhaps New York City. But we always found, and it has to be joint, but law enforcement's attempt to eliminate the supply was not nearly as successful as societal attempts to reduce the demand. And if the demand gets reduced, then the supply will necessarily also dwindle.
Steve, we have a couple of minutes left before we have to go to break, so I'm going to give you a chance to say a couple of final words, but we'd like to have you back on some, regular basis, if you don't mind, just kind of keep us in the loop on some healthcare matters that, affect us all. So, final thoughts from you.
All right. Well, I would say that in a future time, I'll just throw out a few teasers of things that we're working on. We're working on long haulers, which are people that have not
COVID.
fully recovered after COVID, and there's a lot of them. They have brain fog, they have respiratory problems, neurological problems, a lot of problems. We're doing a lot of work in that area. We're also doing a lot of work around population health, which really is about wellness as opposed to sickness, something that hospitals typically don't do. We're making a lot of progress in that area. I want to talk about our new emergency department, which is 2.5 times as big as the last one.
Wow.
Absolutely fantastic that we opened just before the July 4th weekend. Just really an incredible facility. And
that's a lot.
I can talk about opioids, all day
Sure.
long because
Give us-
we've done
great.
so much in that area.
Great. Steve Kelley, President CEO of Ellenville Community Hospital, thank you for coming on with us. We're going to have you back again. You're doing a great job. Just
Hear your voice with Don and Tony.
What's that? Say it again, Steve.
Is he gone? He's still on the line.
No, I'm still here. I'm here.
Okay. Yeah. Steve, thank you for being on with us today. We appreciate it greatly. We'll have you back, and keep up the great job that you're doing and that of your staff. And you're a beacon in a dense fog.
That's a good way of putting it. Steve, I got to tell you, the Ellenville community,
Tony, I learned it from you.
Ellenville community is extremely fortunate to have you there.
Ulster County is. Okay, my friend. All the best. Be well.
All right. Thank you very much.
Take care. All right, Lawrence, take us to break.
You're listening to Kingston Community Radio on WGHQ Kingston. On your radio at 920 AM and 92.5 FM, and also online at mykcr.org.
Question: what will you find on all over-the-counter or OTC medicine packages to help you choose the right drug and use it safely? The answer: the drug facts label. This label lists the medicine's active ingredients and purpose, how much to take, and warnings you should know before using it. Remember, even OTC medicines you buy without a prescription can cause side effects you don't want. So follow the information listed on the drug facts label. For more information, visit fda.gov/drug facts label. A message from the U.S. Food and Drug Administration.
Introducing the YMCA. Sure, you know the Y for a swim or a game of hoops, but we're more than that. We're a cause. When you take a jump shot at the Y, someone else is getting job training. Practice yoga as a team practices her leadership skills. We give people of all ages, incomes, and backgrounds a chance to learn, grow, and thrive. So while you might think of the Y as the place for lifting weights, we're also about lifting entire communities. That's the Y. We're so much more. Visit ymca.net/more.
At St. Jude Children's Research Hospital, we're fighting against childhood cancer every day. At the heart of this battle are our donors.
Most of us want to make some type of difference in the lives of others. St. Jude does miraculous work.
The fact that no one has to pay, it's a place where everyone is treated as an equal.
Everybody is welcome here. And it doesn't matter your religion or what part of the world you're from, all that is taken away. It just gives you some hope.
It's just a nice feeling to put your energy into something that really does genuinely make a difference in a child's life.
There's just no greater gift. If we have the ability to help, then we have a responsibility to help.
Finding cures, saving children. St. Jude Children's Research Hospital. Find out how you can help at stjude.org.
Hi, this is Tony Marmo from Norman Staffing, and we've been bringing together employers and job seekers since 1980. If you're an employer and have job vacancies, let Norman Staffing help fill them with permanent or temporary workers. We screen, interview, and recommend the best candidates for your company. We make the employment process easier and faster for you. Please call Norman Staffing for your employment needs at 338-9111, 338-9111, or normanstaffing.com.
Hi, this is Jim Quigley, Supervisor of the Town of Ulster, and I support Kingston Community Radio, and so should you.
Rondout Savings Bank has a long history of serving local communities and maintaining a strong tradition of customer service excellence while providing each customer with the personal attention they deserve. Rondout Savings' approach to community banking puts you and the growth of your business in the front of everything they do. They're a different kind of bank and would like to tell you why, so please reach out to one of their expert business bankers for an appointment and let them show you what they can do for you. Rondout Savings Bank, always working for you and the community with branches in Kingston, West Hurley, and Hyde Park. Also online at rondoutbank.com. Equal housing lender, member FDIC.
Interesting conversation.
All right, folks, we're back on the air. This is Thunder Thursday, and it is that.
You know, we should have asked Steve Kelley whether he could also prescribe something for you.
I don't think there's anything made.
There's nothing made.
Well, they're still working on it.
This is Kingston Community Radio. We're having a great discussion today. This is Tony Marmo.
And Donald Williams.
And we're joined by the Vice President of United Way of Ulster County, Sue Marcy. Welcome.
Thank you.
And we're going to put her to work immediately on birthdays.
Okay.
So we have, that's what's going on. So, Sue, you can start off.
Okay, we are please wish a happy birthday to Irene Esposito from your friends at People's Place. We hope you enjoy your special day.
Okay,
happy
Judge.
birthday, Irene.
You said that wonderfully.
Yeah,
Thank
she's
you.
got
Made for radio or TV.
Oh, thanks.
Right.
Many people have told me something similar. They said,
Oh.
face made for radio.
I know now you broadcast.
This is a happy birthday wish to Lori Bennett.
Okay.
And it's from your friends and family and everyone you took care of at the Wound Car?
Maybe it's
I
the
thought it would be the
wound
Center.
maybe it's the wound care center.
Yeah, Wound Care Center. Yeah, right.
Happy birthday to you. And then a second one. Since I'm getting these, am I getting a raise, Tony?
You are.
This is two of these I have to do. What, you're doing none?
Yeah.
Sue and I are carrying all the weight. The second is a happy birthday wish to Janet it's Van Leet. I thought it was Van Vliet. Van Leet.
Okay.
Love from Marianne and William Banks Jr. And the winner?
Okay, the winner of the delicious cow pie from Boy's Theory Milkhouse at 62 O'Neill Street. Have you ever had one of those, Sue?
Oh, I haven't, but I had ice cream not too long
they're delicious. So the winner is... By the way, you'd have to do that.
Don't do that while I'm drinking the coffee, please.
Did that come out your nose?
Saratoga is open, so so the winner is Janet Van Leet. My guess is that it's
Van Vliet.
That's my guess. But Janet, please pick up your cow pie at Boyce's, and it's a great place. It's a legendary location for ice cream, and so we oh wait.
I get the connection. I get it.
Right. So, all right. So, welcome to our show.
Thank you. Thanks for having me.
Is this kind of sort of a first, or maybe?
I've been on Kingston Community Radio, but I don't know if I've been on your show before. This is the first time I've met Don.
This is.
I know Stacy quite well. Please, Stacy, if you're listening. You're missed by this former DA and judge. We work closely together, Stacy and I.
Yeah.
Probably are on the opposite ends of the political spectrum. However, we worked wonderfully together on some really good programs. And she's a great lady.
Yeah, she has a lot of respect for you and the work that you all have done.
Thank you.
So, Sue, give us a little bit of background on yourself before we talk about the United Way of Ulster County. And you grew up where?
I grew up across the river in the town of LaGrange, so
I'm a
Hudson Valley native.
Oh, okay. Dutchess County.
What you may not know is that I have long ties to the Kingston area. My dad was a phys ed teacher in the Kingston City School District when I was a little girl, and I used to come over with him, and we'd have breakfast at Lindy's Diner, and he was also an assistant varsity soccer coach at SUNY Ulster.
Okay.
With George Missouri, so I remember fondly going to soccer games there, and he was the varsity coach at Kingston High School as well. So I'm
his first name?
James Studley. Jim Studley. He was killed in a car accident back in '78. But
how old was he when he passed?
48.
Oh wow.
That was tragedy, but
so Dutchess
my roots
County.
go deep. So
Okay,
my
great.
first job out of college was for Phil and Shorty Chase at the Casket House of Gifts in Woodstock, New York.
Okay.
So
and you survived Woodstock.
I did. I actually had a great time. It was fun
place.
out of school, but since I've worked on both sides of the river, but I've been here in Ulster County I'll be going into my 18th year at the United Way. So.
Wow, that's a long time.
Yeah.
I know there's probably life before the United Way. And what did you do previous to that? Between Shorty's?
Between work for Phil and Shorty and the United Way, I worked at the Institute of Ecosystem Studies in Millbrook, New York. I was the visitor services coordinator. I ran the gift shop, managed the volunteer program, planned all group tours and visits. And I was there for 13 years, and then I worked at a private boys' school in Pauling for 3 years. I was the director of alumni relations there, and I planned all on and off campus events for alumni for 3 years and fundraising and what have you. And then that brought me to United Way.
And you met Stacy, and that was it. That was
yeah, it's been a great partnership ever since,
Yeah,
and she's
yeah.
been a great mentor to me. And I'm a Marist grad. I have a business degree and a minor in sociology. So I never knew what I wanted to be when I grew up, but I always knew that I wasn't someone set out for the corporate life. I didn't want to be in a cubicle and be a number. I wanted to be in a place where I knew everybody and I could make a difference. And I'm very, very excited that my career led me to here, and I've been able to grow in this position, and I love it. I love the work we do.
United Way in 2003 is different from United Way of Ulster County in 2021.
It most certainly is. Yes.
What's the biggest change in your mind that you've seen over that
during my
span?
tenure?
Yeah.
There's a lot more community partnerships, and I think especially now we've always been relevant, but I think more people are aware of what we do, and we partner with a lot of people, and we help a lot of people.
Right.
And I think what's unusual for our United Way, talking to other United Ways around the state and other counties, we have a really great relationship with our agencies where we fund the programs. Where it's very collegial. It's very much partnership. If we just went through our allocations funding cycle, where we review proposals. We have 5 different committees with volunteers that review all proposals that come in. And where we're different from other funders is that we actually, if we have questions about a proposal, we bring agency people in, usually the program people, not the agency director. We don't want the dog and pony show. That's what they're paid to do, and that's I don't mean that to be derogatory in any way. That's the CEO's job or the executive director's job. But we've talked to the program people who are on the ground. So sometimes folks may not write a great proposal, but when you talk to the people that run the program, they're just so passionate about it. It comes alive. So we actually give them the opportunity to answer all the questions in person. We did a lot by Zoom this year, obviously. And then our committees make funding recommendations to our board, and then the board makes the final decision. And so we fund on a 2-year cycle, and we just finished all that. So we're very, very proud of the process. New programs come in to be vetted, and, for whatever reason, they may not get funded because they don't have certain pieces in place. We're very strict. You got to have a formal structure. You got to have an evaluation piece in place. You have to be domiciled in Ulster County. You have to serve Ulster County people. You have to say do what you say you're going to do. It's great that you have this program and you're the executive director of the program, but you have a full-time job someplace else. That raises a red flag for us, or there's been a big change in leadership or something. It's like we might wait till your leadership settles down a little bit. Right. And on the same token, if there's a program that's been funded for a long time and they have staffing changes or personnel changes or just obviously in the last year changing needs in the community. We work with them. It's not like, we're not going to fund you anymore. That's not how it works. How can we help you? We have our volunteers will say, have you thought of this? Have you thought of that? And a lot of times they've been able to network through the volunteers even and get people in place to help certain programs and what have you. But we usually go bend over backwards to make sure the programs are working and doing what they say they're doing before we ever say, no, we can't fund you anymore. That's not who we are. So we're very, very proud of that process. And
you've changed significantly. I think over those 18 years that you've been here, I was also thinking about your funding streams have changed pretty significantly. Right back in the day, there was a fair amount of payroll deduction, right?
Correct.
Right. Well, I think when Stacy first started, IBM was still here, and it's still one of our larger accounts, even though they don't have
physical presence.
Here.
Yeah.
Thank you.
Yeah.
But it's changed. 18 years ago, our funding streams. 80% of what we got was from corporate gifts, and 21% was 29%, 19% was from individuals, and it's completely reversed.
Yeah, sounds like Steve Kelley. Huh?
Yeah.
Boy, that has to be difficult.
It is challenging.
Very challenging.
And there's not a lot of large employers here anymore, or they are not headquartered here.
Right.
So if the
I mean,
headquarters are elsewhere, those people have different funding priorities than necessarily what's most priority in Ulster County as far as we're concerned. So that's a challenge, but we're diversifying the funding streams. We do grant administration, and we get funds for that, and we are different various partners that we're working with.
How do you work with the county itself? I know that when I was district attorney, we were strongly encouraged to encourage the people that worked under us to be a part of payroll deduction for United Way. And
Buck a week, right? Buck a week.
I know. I think it was
or $2 a week.
It was significantly. It depended upon what person's. When I was an assistant EA making $15,000 a year, it probably was a buck a week. Right. But it really, and I don't want to say there was pressure. It was encouragement, and you contributed based on what you could afford.
Yes.
But
And
the
that's what
county
we
is
ask.
a huge workforce. Are they
It
still major contributors?
There are some loyal contributors at the county. It's changed. The climate's changed, from, again, it depends on the leadership and what have you. And
Pat
I
Ryan
think
is
a lot
very-
he's fabulous.
Very progressive. So.
He is. And I think what we're running into now is we're seeing, and I'm sure other nonprofit organizations are seeing the same thing, our loyal group of donors and workers are all, the baby boomers are all starting to retire.
Right.
So once folks retire and they're on a fixed income, it's a little different as to what your charitable contributions are going to be. So we work very hard at, doing events, doing partnerships, we still do, fundraising, of course. We have plans in the works to, try to we need to get a hold of the younger folk, the younger working population, and how do we track them? We're not your grandfather's United Way.
Not just tracking them. There's an entirely different attitude, which there always
and most of them are very community minded and volunteer oriented.
They are.
So
and
they just need to know who we are and what we do and how we help. And
But you need to set up a Venmo account or PayPal account because they're not. They'll hit
text
that
to give 50155.
There you go.
Text Live United to 50155, and
go.
it'll come to us.
And imagine you can always go online.
Absolutely. We have an online presence. Yes, our website's ulsterunitedway.org.
Yeah. It seems like, again, more hands-on type things have occurred over the years. That you're talking about grant administration. Talk about that, how you facilitate and...
Well, for example, during the pandemic, we partnered with the county with Project Resilience, and the county's not allowed to receive funding.
Right.
We are. So we were the fiduciary agent behind Project Resilience.
And what is Project Resilience?
Project Resilience, during the pandemic, originally started to help provide food for those who are hungry. There was a donor that established the fund, and then we raised other funds through an online presence. And those funds went out to restaurants, actually, who provided hot meals. And there were volunteers throughout the county that banded together to deliver those meals to the homebound,
Very
or
important.
folks came to central areas, what have you. And that changed, along the way. It stopped being, it helped restaurants, have income and workers get paid, and then folks had food who couldn't get out and couldn't get to food and what have you. And then it changed to groceries were delivered or picked up, and then they've moved to childcare most recently. So it's sort of evolved as the community needs evolved. But we were, give Pat Ryan credit. We were state of the art for the country. I think it was. We had people calling us all over. How did that work? How did you do that?
Yeah.
So we were very proud of that partnership and being able to help.
Great.
And it was, I've always said Ulster County is such a unique place to live and work. People really, it's a big county, but it's got a small town feel, and so people really stepped up to help others. When you have clients who are 57 years old, disabled with Parkinson's, and they're worried about how they're going to pay their increased heating bill in the wintertime, there's programs to help with that. Or there's, I could say, Kevin, call this number for Project Resilience, and they delivered groceries to him, because he couldn't get out, and he was high risk, and then he couldn't get a shot because he didn't have transportation and he couldn't get there, and so they finally opened it up so he could go get that, and I used the county hotline number for Project Resilience, and that helped tremendously to people.
Yeah.
Also, we found during the pandemic the larger population of immigrants that we were helping serve with the Ulster Immigrant Defense Network and Reaping the Harvest and some other community partners. Folks that were greatly impacted by the pandemic because they worked in fields that were hardest hit. restaurants, hotels, agriculture, construction. Those folks are always very proactive about paying their rent and their bills and what have you. They don't want to be behind. And it was a whole new population for us, and we got new partnerships out of that to work with people, and very happy to help them and make sure they were able to access whatever resources there were available for them.
Yeah, so it seems like you've been much more responsive in terms of, current events and what's going on. I mean, historically, I think United Way was viewed somewhat as a funding conduit, right?
I think that's how it was established.
Right.
And it's different in each community, obviously, and each United Way is independent, so we're a local, independent, non-for-profit organization. We have a board of directors that we answer to.
Right.
We set
local
board. Local. Yes, can't say that enough. All the money stays in Ulster County.
Yes.
We set our own funding priorities. Yes, there's an overarching national, gives you guidelines, but you're not, there's no United Way police saying you have to do this. Every United Way adapts to their own community. So we're really, and I think because we're smaller, we're able to react and respond a little bit quicker, and because Stacy's been in this community for 24 years. She's very well connected. Obviously, she's worked with Don, we've worked with you in various capacities over the years in your various places. That's why we're here. We're here to respond to community needs. If we're not responding to community needs, then we shouldn't be doing, we're not useful.
Absolutely. No, I was thinking about this. I started on the United Way board in the early 80s and was on the fund distribution committee with a couple of folks. And that was really my first exposure to Ulster County in terms of volunteerism with a fellow by the name of John Stokes, who used to work for the Social Security Administration. Eric Kaiser, I think, was on that fundraising committee. I have to go back, distribution.
Kaiser Funeral?
Yeah, Eric.
Good man.
There's a couple other, there were 3 or 4 of us that, I think Peter Fallon, who used to, where I got to meet Peter Fallon, was the HR director from Metropolitan Life, who later joined Kingston Hospital Board and became board president there. Yeah, I mean, it's a wonderful and marvelous organization, and you and Stacy have done such a great job evolving, talk about some of the fundraisers that you do now. I know there's some of them are kind of fun. And
our funnest fundraiser is Dancing with the Stars Ulster Style. That's going to be happening April 1st in 2022. So we're on the calendar. We have our dancers from our last round that we've had to postpone twice because of the pandemic. So we finally just said, okay, we're just going to do it in 2022. And they're all back on board. So we're very excited about that. That's a great fundraiser that we do.
Yes, a lot of fun. And you raise money.
We raise funds, and again, it all goes back to the community and our community fund that funds right now. There's 30 different programs at 14 different agencies. And another thing that we've done, you were saying we're more hands-on these days, we've about 12 years ago now, we took over the administration of the local VITA program, which is the Volunteer Income Tax Assistance.
Oh, great. Okay.
And we've been doing that, as I said, and this year, obviously, we couldn't do it in person, and we provide free tax preparation service for low-wage workers. Anyone who was making under $55,000 was our cap, because that was part of the formula for determining those who earned income tax credit to their families. So we use that as our barometer. And this year, excuse me. Our volunteers obviously couldn't come. Most of them are seniors, and they couldn't come to the office. And we didn't want folks we didn't know coming in and out of the office because of the pandemic. So we pivoted to pretty much a virtual platform. We had folks drop off their tax documents. We'd have volunteers that would review them and make sure we had everything, and then we'd scan them electronically and get our volunteers. Tax preparers would access them electronically, do the returns, call the taxpayer if there were questions. Another volunteer would actually go through the return again, review it all, and then call the taxpayer and go over it with them over the phone.
That's great. And then this is a free of charge.
This is a free program, and we always need more volunteers for that. So we were able to do more tax returns this year than we've ever done, because we usually just did it on Saturdays, and people would come in. There were 4 time slots depending on the number of volunteers. So
enabled you to serve more.
And serve more and more flexible for the volunteers. You didn't have someone sitting there in front of you. You weren't nervous about making
Right.
sure you did it all right. You could take your time, do it, and they could do more returns, and they could do it from home.
Right.
So it really worked out well. We're going to continue that model going forward. We may have some in-person days, but the majority of it will be out of house. And I have the numbers here. Normally we do it for about 5-6 weeks, and this year we did it from February through May.
Wow.
And we did 180 returns, and that's with 6 volunteers.
Wow, that's great.
6 volunteers that did that. So we're actually taking them all out for dinner tonight to say thank you at Old
Wow.
Savannah.
Very
So
good.
Where are you headed, Sue?
Old Savannah, come on down.
Old Savannah, there you go.
That's a great one. I
Savannah,
just
yeah.
might.
So we're
So,
looking
folks, you're
forward to
listening to Sue Marcy from the Ulster County United Way program. And, Sue, give some contact information, website.
Sure. Our website is ulsterunitedway.org.
Okay, that's easy.
That's easy. There's all kinds of information on there, all about our new campaign incentives, all the programs we've done. There's videos about funded programs. We didn't talk about our Raising Hope mentoring program. We're always looking for mentors for our women's mentoring program. They're doing a new training in September, so contact Amy Summers for that.
So what is that program? Because we do have a few minutes here.
Oh, good.
Yeah.
It's a one-on-one mentoring program for women. We have women volunteers that agree to do it for a year, and they're paired with another woman who may be at a crossroads in her life. Maybe she's gone through one of the human services programs and she's graduated, so to speak. But okay, I graduated, great, now what do? I want to do this, this, and this, but I'm here, I don't have any supports. As someone said years ago, women need mothers. Extended families are not, as traditional, the traditional families aren't as available as they were. Maybe the woman came from a difficult situation, she can't go back there, or it's not safe to go back there, or if you went back there, you're certainly not going to have the supports you need. And we found that just by having another woman in your corner, women are like 75-80% of them are reaching the goals that they set for themselves, whether it's going back to school and getting a degree. We've had several getting master's degrees now.
That's
Folks
great.
have gotten new jobs, they've gotten new apartments, they've gotten their children back. They've gone through various treatment programs or what have you, and their goal was to be stable and get their children back. And we've been
How do
that.
the women that are in need, or how can they reach out to you? Is it just online?
You can do it online. They can also
phone?
call us. Yeah, the number is 845-331-4199. That's our main number.
And that number would be available online also,
Absolutely.
in case they want to speak to a human being.
Absolutely, yes. No, we encourage that.
And
our program director is Amy Summers, and she's fabulous with this program.
Are there certain qualifications or certain criteria for?
For a mentee, you have to be over 18 and free of substance abuse issues for 6 months, and just wanting to grow and learn and
And then
stable.
you can assist them not only in their personal well-being, but also in getting apartments. Is that?
We don't get them the apartments, but we have someone there to say, okay, what are you thinking about? Have you tried here? Have you tried there? It's more, like having a big sister or an advisor, so cheerleader in your corner. We also provide monthly workshops online, and this is where the program pivoted beautifully during the pandemic. We didn't realize, but they actually had higher attendance at their monthly workshops because there were no transportation issues. There was no child care issues. They could do it from their home. And they all participated, and the presenters for the workshops were great. They also do monthly mentor training. So the mentors actually have a support group, the mentees have a support group, and they do these ongoing continuing education. We've partnered with local banks and financial institutions. Other local business people have done things on resume building and how to identify your next steps, building a budget with the bank, setting up a bank account. Sometimes it's
a great program.
It's
That's been going on for a dozen years or so-ish?
Yeah. It's 2007, I believe we started it. It was part-time up until about 3 or 4 years ago. Then we went full-time, and then we have a full-time program director and an assistant program assistant. So.
We have just a couple of minutes left. I'm on the back of your business card. There's a dial 211. Can you just briefly tell us what that is? You'll have to come back and
I would love
tell
to
us
come
more
back.
stuff.
Sure. Yeah,
but
we
tell
only
us
hit on
what-
2 things. I have a whole page full here. All kinds of
I
notes.
always love it when one of the guests come in and they have out
prepared notes.
Prepared notes.
And big letters so I can read it with my bifocals that the dog ate last week. So
what's 211 real quick?
211 is an information referral service. It's a free call. It's for all health and human service related issues. It could be you just moved to the area and you have no idea what kind of after school or summer camp programs there are. You can call 211 and they can say, what county are you in? It's a 7-county area. This
That's
calls it a
great,
free
yeah.
call. And they can tell you there's also an online, I believe, I'm going to get it wrong. So if you just do 211.org, it'll ask you what area you're in, and it will
caught my eye because we were talking earlier with Steve Kelley about addiction, and one of the questions, this is really well done. The back of it says, I'm addicted to drugs. How do I stop? Dial 211.
Yeah, and
You
it's
wanna make
it's
a-
available 24/7.
Right.
It's
I wanna-
headquartered in Westchester, just because they
Great.
have the operations center
No, I
there.
get that, but it's a great. My spouse gets violent. What can I do? I want to volunteer. Who do I call?
I know Leanne personally.
I was going to say, what? You didn't tell us that.
Let me say, I doubt that that's the case, but
she might be
should she
listening.
do
Think
that?
it, she may think it once in a while.
There's something under the law
Yeah.
called
That's called
justification.
a frying pan, you know.
I think we've all of our spouses have been there. Yes,
Right.
sure.
Sue Marcy, Ulster County United Way, thank you so much for coming in. We're going to have you
having
back as well. Please say hi to Stacy for us.
Certainly will.
And keep up the great work that United Way is doing. It's an amazing organization. It's helped thousands upon thousands of people over the years.
Yes, thank
And
you so much.
we're so proud to have you and Stacy as our leaders.
I
So
appreciate that. Thank
yeah,
you so much.
Thanks. Okay.
You're welcome.
Folks, come on
Glad
back.
to meet you.
Lawrence, take it away.
You're listening to Kingston Community Radio on WGHQ Kingston. On your radio at 920 AM and 92.5 FM. And also online at mykcr.org.
Central Hudson reminds you that summer thunderstorms can strike with strong, gusty winds, knocking down trees and power lines. If you see a downed power line, call 911 immediately to report it. Power lines can carry an electric current strong enough to cause injury or death. Stay at least 30 feet away from a fallen line. Don't try to move it or anything that has come in contact with it. And never drive over a power line. Remember, your safety matters.
There was this one time I went snorkeling in the Caribbean when I was a kid. It really just blew my mind. We saw the most beautiful corals. I remember thinking they were waving at us as they moved with the ocean. And then there were all these amazing fish. I'll never forget it. It completely changed the way I look at the ocean.
Most of us have a memory of being in nature we'll never forget. Let's protect the world's natural places so more memories can be made for generations to come. Visit worldwildlife.org.
Have you ever experienced a wish come true? For a child battling a critical illness, a wish come true can be a turning point. One song, one dance, one game, one adventure, one moment changes everything. Make-A-Wish needs your support to grant the wish of every eligible child. Visit wish.org now to help grant more life-changing wishes. Together, we can transform lives, one wish at a time.
This is the story of Daniel, who was born 2 months early. His lungs weren't ready. His heart wasn't ready. His parents could only hope that one day he would leave the hospital healthy, and they would all live happily ever after. Daniel's is just one of the more than 500,000 stories of babies born prematurely last year. You can help the March of Dimes stop premature birth and bring more babies home healthy. Learn how at marchofdimes.com. Working together for stronger, healthier babies.
Hi, this is Winnie from the Rosendale Seniors, and I support Kingston Community Radio, and so should you.
This portion of Kingston Community Radio is brought to you by Ulster Savings Bank. Visit their newest branch, conveniently located at the Ulster Commons Plaza in Lake Katrine. Experience the difference that local community banking offers with the convenience of another great location, easy access, plenty of parking, and a 24-hour ATM. Ulster Savings Bank, invested in community, invested in you. Member FDIC.
Okay, folks, we're back. This is Thunder Thursday.
Can I ask to go to Wednesday or Friday?
You can, but I'll come there too. And
only if you're. That's right. Friday would be Hugh Reynolds and Mario Cadillac.
Yeah, that's true.
It's always interesting.
Right. So we have a surprise guest today. This half hour.
We're very fortunate. First, you are Tony Marmo.
I am Tony Marmo. Yeah,
I am.
You are Donald Williams.
Thank you. You
former.
Struggled.
I didn't struggle. I was just trying to figure out what to call you.
Well, you always say introduce yourself.
I know.
And you always forget to introduce yourself.
Predisposed to talk about the why,
and we are
a great guest. We just want to introduce.
We're really fortunate in the brief history of this. Oh, Dave, yes, sit close to the mic so you can be heard.
There you go. Want to introduce our guest real quick?
I will in a moment, if you don't mind. I know you are the host, and I'm
No. I'm just trying to read the YMCA announcement here.
I had arrangements with one of. Well, why don't you do that first, and I'll introduce Dave.
Okay, that's fine.
I mean, since you're chomping at the bit.
I am chomping at the bit to talk about bike-friendly Kingston to repair bicycles. It's this Saturday. So if you have a bicycle you want to get repaired, we're going to talk to our district attorney, Dave Clegg, who was on the board of the YMCA with me for many years and a great, basketball player and supporter of the.
We're not going to go through the athletic supporter again, are we, for God's sakes? Dave is a great basketball player, very competitive, just like he is in court.
So let me just tell real quick, celebrate summer with the Kingston Food Co-op Summer Party and get your bicycle checked over by volunteers from Bike Friendly Kingston this Saturday, July 17th from 1 to 4, 718 Broadway, the Big Bubble Laundromat parking lot. Okay, so it's not at the Y, it's at the Big Bubble Laundromat. Everyone knows where that is, across from City Lights. No advanced registration required, but you must sign in by 3 p.m. The event is free, donations are welcome. And again, this is Tom Polk, who's like Mr. Bike, right? That guy is
Tom Polk. Is
amazing guy.
Is he married to Betsy Jordan?
Yes, he is.
Good man.
He is. So this Saturday, 1 to 4, celebrate Kingston's Food Co-op Summer Party, which is great. That Food Co-op program is great there, Dave. Over the years, the Y's done a terrific job with that. And get your bicycle checked. So that's the YMCA announcement.
And now I'll do the formal introduction.
Now you can do the formal introduction.
We're really fortunate to have Dave Clegg, our district attorney, here this morning, especially since you came, and I know how busy you are because I was there for a lot of years, but especially you came at late notice. We were going to have one of your young assistants, Paul Darohanassian, say that name 3 times fast.
Yeah.
To come, but then we had some miscommunications, and then at the last minute, Dave agreed to be here.
Yeah, thank you.
Timing.
Thank you for coming in.
Timing couldn't be better because there are some issues that are really significant to the community, and it's great to have you here. So perhaps if you're kind enough, you'll address some of those. But Dave, and so everybody understands, I do have a history with Dave Clegg. First. I think I was chief assistant DA at the time, not DA, but you stepped up out of the goodness, not so much financially, but out of the goodness you represented an individual who was accused of an arson, major arson, complicated trial, and you stepped up and defended that person and did. I will say you lost.
However, there was a moral victory in there somewhere.
No, not just a moral victory. I mean, I've tried a lot of cases against a lot of different lawyers, New York City lawyers, Albany lawyers, people from out of the state. You did just a great job, very impressive to come into court under those circumstances, especially in a very complicated, difficult case. You did a great job. And then, when I did not run for the 3rd term as DA and trying to decide what in God's name I was going to do with my career, I actually started working for Dave.
Oh, great.
For about a year, and kind of gave him an informal agreement I would be there for a while, not knowing that Micah Brune, the county court judge at the time, retired without much notice, and Mike persuaded me to run. I remember it was a difficult it was, in my mind, going to be a difficult day, but I had to tell Dave that the informal commitment or oral commitment I had made, I was looking for the opportunity to run, and Dave, like a real professional and gentleman, said there was no issue. In fact, you were quite supportive, as I recall my run. So there is a history. I have great respect and admiration for him, and unfortunately, you came into the position at the most unenviable time. You came into a position with a pandemic occurring, with a new county judge that had never sat on a bench before at all.
Counselor, is there a question here?
I'm trying to, Steve Kelley said I'm asking softballs. What do you want to, talk about athletic supporters again, Tony?
No.
So anyway, Dave.
Yes.
Just so you have that background.
Yeah.
Difficult position. There are a few topics we'd like to address, if you don't mind.
Yeah,
First
let's
of all,
talk about them.
By
the way, there was a mutual admiration society.
Yes.
We did try a case together. I was so impressed with his trial skills that when the opportunity came up, I hired him.
Mm-hmm. And
smart guy. You're a smart guy.
Dave and I may have, in certain areas, difficult or different philosophies of criminal justice, although generally I agree we are on the same page, especially with the initiatives to address underlying issues such as opiates and stuff that we'll get to. But first of all, a chance for you to address the issues with some of the assistant DAs that have left.
Right. I think you started talking about this earlier, perhaps, but anytime there's a new administration coming into an office, there is generally a transition with people, including, of course, the former DA and the former chief assistant were part of that group. And there were 2 or 3 people who were loyal to that group that decided that they could go someplace else, and that happened.
And those loyalties almost becomes like family, especially with the chief assistant and some of the senior people.
Not unlike any business, or if there were a change in CEOs, right? Happens at the hospital, there's folks that are brought in, and when that leader goes, those connections go.
That's right. So, and of course, I brought in new people, and we have some terrific, really committed, dedicated people who've come into the office now that I'm really proud that they're part of the office and watching how hard they're working. Now, you mentioned the perfect storm issue with this office, because one of the things that we had to confront right away was obviously we had to hire new people. A month and a half into my term, in March, they started a hiring freeze. So we had still not been able to get fully staffed.
The county would not permit you to hire assistant district attorneys to replace? You weren't asking for more?
That's right.
You were asking for replacements?
Hiring freeze, right?
I'm not going to...
And not to get, that was a county-wide issue.
Right.
We also lost 2 people during that, or 3 people during that time period that we could not replace while a hiring freeze existed. 2 of those people, one was a receptionist, one was a secretary, another was another ADA. So during the entire time I've been there, we have been somewhat understaffed. Now, the biggest problem is that because of the court closure that happened as a result of the pandemic, we were not able to move cases. So there was a 6 to 9 month period where we are getting up to 100 new cases every week.
Crime didn't go away.
Crime didn't go away.
You're
and,
right.
And serious crime, as you know,
Right.
has increased.
Right.
So there was no place else to go but to drop down to our caseloads, right? So every attorney in my office now has a caseload that's triple what it ever was before. On top of that, we have the discovery law, which started in January 2020.
Could you explain a little bit? So that people do not understand the obligations on a prosecutor for discovery.
So with the new discovery law, the issues that have been confronted are that we have time constraints on every single case now. So that we're supposed to give them all the discovery that we have in 15 days. Or if it's a very complicated case, we get additional time, depending on the circumstances. And you can go back to court and ask for additional time if it's really complicated, such as a murder case, which might have 360 leads, terabyte of information, which is a tremendous amount of information for those who know what a terabyte is. So that is something slightly understaffed the whole time, that all of a sudden in every case we have to do that. Now, Don can tell you, before this happened, there were always cases that you knew you could resolve with plea bargains or whatever. There was 80 to 90% of those cases were resolved pretty easily. You give the essential records that the defense attorney needs to look at to make a decision, and of course there's Brady material, which you would always provide, but not every single piece of evidence possible. Now, right now, we have a new world where we have car cams and we have body cams. Just a case I was talking about with one of my people yesterday. We've got to rush it, right? I said, we've got to get this done. There are 30 hours, and this is just a regular, not a regular, but not run-of-the-mill, but it's typical. It's a drug dealing case, a drug sale case, but there's 30 hours of body cams that have to be looked at. In every drug case, you need to look at those body cams because there may be a person in there who might be a confidential informant. So we have to look at all that even before we send it.
Confidential informant has to be blocked out of the video.
That's right. So we have to do
confidential informant is somebody that's working with the police in return for something. And obviously has to be protected. They say, well, what's the big deal? The defendant knows who the person is, yes, but you don't want over the internet a picture of the confidential informant that is working with the police because confidential informants do get killed, even in Kingston. So anyway, Dave. And discovery, just so the people know, discovery is what the prosecution is obligated to give to the defense from your file, which is the bulk of information. When I was DA and when I was judge, the time that you were allowed to give the discovery, most of it would come sometime immediately before trial. Now, what is your office obligated to do?
In every case within those time periods that I talked about. So,
and you're talking about 30 days now, correct? Or 15 days?
15 days, depending on the complexity of the case. But where before this happened, in the 80% of cases that were resolved, you didn't have to do all that work. You didn't have to look at in fact, they didn't have body cams until recently anyway. So it's just the complexity of discovery has increased.
And because of that timing, for us, that discovery, the providing of body cams or transcripts or oral conversations or anything, if you were not required to give that until shortly before the trial, and the body cams we gave earlier and stuff, but before the trial, you could work out these resolutions in 80 to 90% of the cases. So in most cases, the assistants were not required to do that paperwork until 5 months.
Did that come down from Albany, Dave? The
Yes.
discovery laws
That's
change came down.
You know, once again, the legislation was required to alter it. But just like the Rockefeller drug laws that had many evils in them, legislation had to be, just like bail reform, it had to be reformed. But it was just grabbed by politicians. And
my guess is they didn't call you and say, what do you think of this? Or what impact is this going to have practically?
In fact, I did go up to the legislature. I went both to the Senate and the Assembly. I spoke with the Speaker, and testified and talked about the consequences of this. Just as Don said, you absolutely needed reform, but the reform went too far.
As it always does.
And it dropped down on every DA in the state. Now, I was just with the DAs throughout the state a couple of weeks ago. Every office, you know what the number one concern is?
Discovery.
Well, that's the cause. The concern is morale. In every office throughout the state.
Right. Making the job impossible.
Right. Everybody is overworked, underpaid, and has a burden that they say, how am I going to do this? Right? That's what they're looking at. That's why I feel like the people in my office who are persevering really should be honored by this community. They should be appreciated by this community. That's right.
What is
I agree.
I know these assistants because they appeared in front of me.
Yeah, they're good and decent people.
It was not easy. But some of those assistants that did leave, out of the 11, whatever the number is, some of them left because they couldn't deal the onerous burden of discovery, and some of them went to the public defender's office that does not have that burden.
Yeah.
And Dave, you've done something now to address some of the issues with Discovery, correct?
Right. Yeah. We had one individual left just because he said, I can't do this, right? It's too much, the workload's too much. Went to the public defender's office, received a $17,000 raise.
Oh, Lord.
So that imbalance is not healthy, right?
Yeah. That's
more money, less work.
Yeah, come on.
And right.
Yeah.
So it's not a good thing.
No-brainer.
But yeah, what we've done, and on his way out, we talked about this, and this is something because we had a hiring freeze for the majority of the first part of my office structure. I was unable to make those changes, but now I've gone back to the legislature in June. I've explained what this burden is. We modeled it after some of the other programs across the river in Dutchess, where we created a discovery unit where we have 6 people who are going to be involved. And once again, in every case, immediately start discovery so that we will collect it. We've got 19 different law enforcement agencies. We make sure we get it. We have to digitalize that. We have to upload it. Then we have to track it and send it
like countless
down to
hours.
the defendants.
It is.
Now, the hope is, though, that it will take a good part of that burden away from the ADAs.
Right.
What you want our ADAs to be able to do is to try cases, right?
Exactly. Right.
And to manage cases and to do the hearings and to follow up and make sure that the witnesses are contacted, the victims are protected and supported. All that work that also needs to be done. And that was the concern where people, especially with domestic violence, we need to be there to support the victims. We need to be there to work with the victim, to explain and carry them through.
Victims' families,
you need time for that. If all your time is spent moving paper, digitally, moving body cams and all of that, it was putting my ADAs in a position where they didn't feel they could do the job the way it should be done. So anyway, we have set that up. We're going to start hiring. That process.
So have the salary imbalances been addressed? Because if you're going to, I'm in the staffing business,
right.
And so if you have a discrepancy in terms of what the pay scale should be, market rates,
right?
How can you attract new people in?
Well, I'm confronting that right now. Of course, we are being outspent and outpaid in every surrounding, whether it be Orange or Dutchess. So we're doing the best that we can to get the people with experience.
And Dave does understand also that people that come into a prosecutor's office and it's what you want, and people coming in are not doing it for the money per se.
Right. But
they're doing it because they have a passion.
No, I get it.
But it has to be, it's never going to be competitive with private practice.
No, but I'm saying
But
within
it's
the
gotta be
governmental system.
within the criminal justice system in the county alone.
Yeah.
It's got to be competitive, and then the surrounding
And
counties.
vis-a-vis the other counties, this is, we know Dutchess pays
especially in light now of the workload that is significant. And public defenders, assistant public defenders, you know that. It's a tough job.
Yes.
It's a very difficult job. But the responsibilities on a prosecutor, and rightfully so, because you're there to do justice, not get notches on your gun belt, but far, far more intense than what defense attorneys do.
And now more than ever before.
That's what I'm saying.
Defense attorneys used to have to make motions to get some of this information. Now it's handed to them. In fact, we can monitor whether or not all this tremendous amount of information that we're sending out to different defense attorneys are even looked at. And sometimes, no.
And there are also ways that, I don't mean get around it, because discovery has to be given, but there are also methods, if you're getting the county court judge's involvement in this, there are also methods of reducing that for the purpose of negotiating pleas, and hopefully you're getting that. But
we have another subject. We have about 5 or 6 minutes. I want to. We could have.
What would you prefer? Talk about the issue with gun violence or opioid?
Well, the opioid is certainly something, and I know you had Steve Kelley.
Yeah, right. Steve's
I know
a great
Steve,
guy.
and Steve's a great guy. And
With the gun violence issue, there are shootings that are happening. There are many different reasons, and as I understand, you recently had a meeting about that with law enforcement. Is that?
I was at a meeting yesterday with the sheriff and with the mayor, Mayor Noble, and Chief Tinty, and people from the state police and people from sheriff's office involving anti-violence initiatives that the sheriff is discussing with the city. And the big thing is let's work all together, right? And I've committed the resources of our office, the district attorney's office, to that effort. So that's something that is in the works. I salute the sheriff for all the work he's doing. As you know, we both work with Urgent. We have a liaison through my office. I've been involved in at least half of the Urgent meetings over the last year and a half.
Task force to address opioid and gun violence.
That's right. And so he does both, and that's what you need to do. Both the investigatory approach where we track them down, you get the buys, you arrest, you convict, and you hold people accountable. On the other side, he's got the Oracle program where he goes to places where people have overdosed and they get everybody possible treatment. They have an addictive problem. They have liaisons now where they have peers that come in and support the group when those occasions occur, as well as social workers there to help address and follow up and make sure that people get into treatment and are, again, followed up after treatment. So both sides of this have to be worked on. My office is committed, and I've said this many times, that if somebody's a drug trafficker, especially with fentanyl is such a dangerous drug.
Steve was talking about that.
And so this office, for the first time, convicted a drug dealer that caused an overdose of manslaughter. That had never happened in this county before.
That's great.
And we also convicted somebody of criminally negligent homicide for the same reason, that they gave drugs that they knew fentanyl was involved. And so you have to have that combination that the person knows that the drugs are really dangerous. And it's such a difficult process because addicts sometimes seek out the most powerful drugs. And if they're told this stuff's really good, it'll, and they carry Narcan with them, so if in case they overdose, somebody will be there, hopefully, to revive them. But so it's a vicious circle.
The addicted carry the Narcan?
That's right. That's right.
Interesting.
That's right.
Wow.
So anyway, our office has made that a priority, that the people who are drug trafficking in fentanyl, we pay special attention to convict and to punish.
Is there a connection between the gun violence and the drug activity? I mean,
the question is,
do
you find gangs and guns connected to the
absolutely?
Violence?
Absolutely.
So I take it that is probably number one as far as the recurrence of violent crime.
Yes.
Guns, gangs, drugs.
That's right. That's right.
Nothing has changed about that.
Yeah. No.
But we are constantly, and Dave has brought some new initiatives that, and it's a combination of two things that have to be done, I take it, Dave. Number one, tough, hard prosecutions for those individuals that are dealers, not users, but dealers of drugs, those individuals that are gang members, those individuals that possess guns illegally, along with the initiatives that you also can bring to address the underlying issues why these people are.
It's good to see that people are getting together, though.
Right.
It's key, right?
It is. It is. It is. And we've been meeting with the community over the last year, and the people in the Kingston community especially, because there is that distrust of law enforcement also, right? Law enforcement has taken a beating.
Have you reconnected with the Ministers Alliance and some of the because there was a period of time for 3 terms that Mr. Carnwright broke off that connection that I had created when I was DA. They are so helpful, and I'm glad to hear you're doing that again.
Well, the funny sidelight to that is that out of the Ministers Alliance, 12, 15 of them, at least half of them played basketball with us at some point in time. So I've got, I'm ordained, right?
Yeah, I remember that.
Don Mapes.
Yeah, Don Mapes.
Is one of those.
Tell
persons.
Don Mapes I said hi.
Yeah, and he's actually having an event in I think the end of July to try and support law enforcement and the community relationship. So so those connections are important, and of course we work with all of them.
And by the way, this is not only an Ulster County issue. We happen to be dealing with it as best we can, and with the resources we have. This is Dutchess, Orange. This is again coming up
statewide.
Statewide. Yeah.
Once again, the district attorney's office statewide are having this problem.
Yeah.
They say that we're part of the GIVE program to try and prevent gun violence, and within the give areas, they've gone up, shootings have gone up, murders have gone up 75% across the state. Across the state. So, yes, and across the country.
GIVE stands for, it's an acronym, obviously.
Yes, yes. Gun initiative, gun violence initiative, yes.
You got 2 minutes, Mr. DA.
Yeah, okay.
Final
So look, the message is that, one, our office is working day and night to protect everybody in this community. They've never, and I don't mean to say your office didn't work hard, but they've never had to do more with less than we have right now.
Right.
And as I say, I think the dedication that I'm watching, with the amount of work that they have to do, not complaining, but coming in early, leaving late, coming in on weekends, that is happening in my office and has been happening. Now, we are getting help, thankfully. We're getting this unit. It'll be up and running within a month or two, I hope. And then that will be some real support for the staff that they absolutely need. We're also, we're confronted with a workload that will continue.
Yeah.
We will have trial after trial after trial after trial, probably for the next year and a half or 2 years.
If you can get a judge to try a case in Ulster County.
Okay. That's. Listen, we thank you for your passion and commitment, Dave. Really, I mean, it's difficult times. The pandemic has just, made a bad situation worse, right? And so you're battling. So thank you on behalf of our citizens and people who care, and that it doesn't get further out of control. Hopefully, the electeds will listen, will pay attention, and if they don't listen, we should find new electeds. That's just how it goes, right? People vote.
I agree.
Get out
I really
and vote.
appreciate the support that they gave us to give us this new unit.
Yeah,
that
that's
was
a big deal.
That was a big deal.
That's a big deal. And thank you for
Certainly
clarifying. The Freeman has a way of, portraying a story in a certain way.
In less than one paragraph.
Yeah, right. So, David Clegg, thank you for all you're doing for Ulster County and our citizens, and keep up the good work, and we're thankful we have you.
Thank you, DA, and don't lose faith.
All right. Yeah. Thank you.
Keep the faith.
Lawrence, everybody be safe, be well out there, and do a random act of kindness for someone, right? Just be kind to everybody. See you.